So first we enter station where she was interested in the breast examination.
Hello.
Nothing, just I'm checking the list.
So we enter to station, right? So we already know it's breast examination. We full name of patient, date of birth, our name, who are we, and what we're gonna do. Okay. We also need to ask female chaperone, and we generally ask several questions.
Female chaperone.
Breast cancer in family, if there is, or if you take any medication, contraceptive, for example. These questions, and we're gonna start examination, which gives us our concept. She agrees, and we will start. We need to undress patient upper body, okay? And first we should start with general inspection, okay? We are looking for the front, if it's symmetry or asymmetry, if there is any retraction of the nipple, or if there is any scar after surgery, swelling, redness, anything. Also, we need to let patient to behind the head, hands during sitting or standing, and on the hips pressing, okay? We are looking for breast, same. After we finish this standing or sitting position, we let patient to lie supine position, little bit head should be tilted, and we will start again for inspection, just checking under the breast if there is anything, and we will start palpation, okay? For palpation, we have two techniques, both are correct. We can start from central, from nipple to peripheral, or from peripheral to central. Okay, let's start with the central because it's easier. So we start from palpation, central to peripheral. Okay, if we find something, we should remember it and then come back. Okay, after we finish, we go for tail of spans between thumb and index finger, and we repeat same on the second breast. Okay. You should say, just if I find a mass, we should palpate like this, okay, between the index and the thumb, okay, to describe what we found. Then we do on the same. You should say, I'm gonna do on the same. After we finish this breast, we will check discharge, both. We will squeeze the nipples, or we will ask patient to do it, because sometimes the patient won't be comfortable, okay? After we finish here, we will start to do axillary lymph node first. We need to catch patient hand in the abduction, and palpate here, okay? After we done, repeat same. Now we change our position behind the patient. Patient is sitting, and we're gonna palpate cervical lymph nodes, and we go supraclavicular and infraclavicular, okay? That's all. After we finish, we explain, summarize something we found, explain to patient, thank the patient, cover the patient, and wash hands, remove gloves if we're wearing, and go to next station, okay? It's not very hard, just remember for inspection, first standing or sitting behind the head, on the hip bones, looking, asymmetry, anything changes, then we gonna check from central to peripheral, palpation, tail of spans here, and so there is a lymph node coming here, it's called tail of spans, and we are palpating between thumb and index finger. Nipple discharge, both, okay, mass check with again thumb and index finger. Then after finish, we're gonna do axillary lymph nodes, then change our position behind to patient, cervical, supra, and infraclavicular, and that's all. No, not hard, guys.
Yes, sir.
You should not describe details of mass. We should say only how to palpate mass. Okay, that's all.
If you feel mass like we need further examination, we can say like mammography.
Yeah, after end you can say thank the patient, remove gloves, explain everything. If I find something, if you can add, but it's not necessary. Okay, if you really want, you can of course add. Okay.
Registration have 5 minutes, 6 minutes.
Sorry. 5 minutes. So
chaperone
feeling, okay, without gloves. If you see cancer or
Wash hand.
something, of course, fast you can use gloves, but mainly we don't.
For all this stage, I don't need to take.
No need for gloves. Only
No gloves for this.
we can use for our to under the arm for cervical as well. Sometimes we use gloves.
Okay.
Family history and cancer history is very important.
Contraceptive
Medication, contraceptive, exactly. We're gonna explain procedure, wait for consent, ask female chaperone, and we're gonna start. We start from inspection. Sitting or standing. First behind the head. First normally like this. See. Then behind the head. Then on the hip bones. We're searching for any asymmetry, swelling, discharge, even retraction, most of the important ones. And don't forget under the breast. Then we let supine position, a little bit head should be lift, and we start for palpation. We start with normal, healthy breast. For example, if here is retraction, we start with non-retraction. We start from center to peripheral. We can do this all the way, circular motion, go to peripheral. If we find any mess, we remember it, don't stop. Go to tail spans here. And if there was a mass, we come back here and check it, okay? Like this technique. We do same on this side. Again, tail spans here during the index and thumb. Then we let patient to sit or stand, but sitting is better. Catch your arm and do axillary lymph node checking. After we did both axillary lymph node, we go back to patients like him. We touch only cervical lymph node, supraclavicular and infraclavicular. After this, we finish. I forgot squeezing. We squeeze or let patient discharge. After that, we thank the patient, cover patient, explain what we find, wash hands, and if there is any additional test needed, we will conduct the test. Okay.